All right, let's talk about biomedical therapy. So, psychotropic medications have been very productive in assisting individuals who have mental difficulties. And there are multiple categories of psychotropics. So, you've got your antipsychotics that are used to treat the positive symptoms of schizophrenia. And of course, when I say positive, I don't inherently mean good. I just mean that something is being added to the situation. So, this includes hallucinations, delusions, and paranoia by blocking dopamine. Okay, because the idea when the biological perspective when it comes to schizophrenia is that there's too much dopamine within the brain, so this effectively blocks dopamine from binding to its applicable receptors. We've got atypical antipsychotics, which treat the negative symptoms of schizophrenia, such as withdrawal and apathy, as well as catatonia, which catatonia is simply a reduced interest with your environment. So it targets both dopamine and serotonin receptors. Antidepressants, so these are your SSRIs, right? They promote neurotransmitter activity and prevent the reabsorption of serotonin, so there's more available within the synapses to continue binding to its receptors. So this has been proven to alleviate symptoms of anxiety and or depression in individuals. Now, one of the main differences, between antidepressants and anti-anxiety agents is that antidepressants are a slow growth process. Whenever you take an SSRI, it takes about 3 to 4 weeks to really kick in and notice the effects of the medications. Anti-anxiety agents are like your benzodiazepines because they depress central nervous system activity. They kick in within the hour and they alleviate anxiety very quickly. Now, these are anti-anxiety agents are something to really be careful of because they can be extremely addicting. And anything that, well, not anything, but the two most common central nervous system depressants are alcohol and benzodiazepines. And whenever you take those consistently and abuse them, and more so the emphasis is on abuse, if you stop taking these medications or these drugs, they can potentially produce a seizure and can potentially kill an individual. So it's always important to be communicating with your medical provider if you're taking any of these anti-anxiety agents in a substantial manner, and especially in conjunction with alcohol, because those are commonly abused together, and whenever you stop taking them, the withdrawals can literally kill people. And I don't say that to try and scare people, but it's just important to make that known and make people aware of it. Mood stabilizers. These are prescribed to individuals specifically who have bipolar disorder, so it can level out their mood so they're not having such a drastic change from a manic episode to a depressive episode. Stimulants, these improve the ability to focus on a task and maintain attention. These are commonly prescribed to individuals who have ADHD, and they are dopamine agonists, so they allow for more dopamine to be within the brain and binding to its applicable receptors. So these are like your Adderalls and other stimulants that increase overall levels of neural activity. Now, other therapeutic approaches that are presented to individuals in extreme cases include electroconvulsive therapy. And what this does is it induces seizures to help alleviate severe depression.